On to chapter 16, talking about oncology or cancer treatment. Physical therapy is often involved in cancer treatment, and we'll talk about how. But really, this is a big, gigantic, enormous subject, and we're just going to scratch the surface of it. So, we're going to define the basic terminology associated with cancer, some current theories on the development of cancer, etiology and risk factors for selected cancers, differentiating between normal cells and cancer cells, clinical manifestations of selected cancers, and appropriate PT interventions, what to do and what not to do. So, cancer is the term that's used to describe a collection of diseases. It's not just one disease, it's a group of many different conditions. So that's why it's so complicated to talk about it. You should have seen how long this PowerPoint was before I whittled it down a little bit. But cancer can affect different organs and body systems. Outcomes are highly variable. Some cancers are curable, some are manageable, some are fatal. Some types of cancers have known risk factors, some have unknown risk factors. So it's a very complex disease and it requires comprehensive understanding beyond what we're really going to do in the scope of this course, but we're going to talk about it because there it is. So cancer is a disease of the genes. By definition, uncontrolled division of abnormal cells that can invade other tissues. So genes are in our DNA, molecules in every cell in the body. We talked about that in the last chapter. The DNA molecule carries the genetic instructions for growth, development, functioning, and reproduction of all living organisms. So they also control the encoding and production of proteins, RNA, including messenger RNA and microRNA. So DNA replication is a part of cell division, and sometimes during DNA replication, there are mistakes or coding errors. That's one source of um, problems with the genes. So if there are coding errors, what's going to happen? Um, there might be damage from that happened during mitosis. There could be damage that happens from environmental factors. There could be other types of damage. So our DNA is repair processes are usually pretty robust. We have processes to identify and repair errors in the DNA, but if they're not repaired, then the DNA becomes mutated and the error becomes permanent. Where this becomes a problem, so a lot of the codes, some of them code directly for proteins, some of them are start and stop codes. If there's no stop code because that area got damaged, then it could produce out of control, and that is one of the problems with cancer. So the DNA mutation can cause the production of faulty proteins that give different messages from a normal cell. It could cause the cell to continue to divide uncontrollably and form a neoplasm or a tumor. But keep in mind, not all tumors are cancerous, but there you go. And not all cancers have tumors. So we'll talk about the different classifications. So confusing. So neoplasm is a tumor, a cellular growth that no longer responds to normal genetic controls. The cells continue to reproduce whether you need them or not, and you usually don't. The problem with that, one of the many problems, but one of the problems is it deprives the surrounding cells of nutrition because it's reproducing out of hand, and so it's taking up all the nutrition. Neoplasms may also consist of atypical or immature cells. So we talked about dysplastic or anaplastic cells way back last quarter. And so those atypical cells can be non-functional as well. The characteristics of each tumor depends on the type of the type of cell that it originally arose from and the unique structure and growth pattern of that individual tumor. So when they do a biopsy, they take out a little sample of tissue, they look at it under the microscope, and they're looking for those weird cells. What's going on here? So lots of different things can cause genetic mutations. We're getting assaults on our bodies at all times, and so four primary categories of things that can cause DNA mutation are genetic inheritance. What are you going to do about that? Environmental carcinogens, like don't breathe polluted air, you know, and expose yourself to benzene and gasoline and all those enes. Lifestyle choices, smoking, you know, I'm always going on about smoking. Lots of other lifestyle choices can cause DNA mutations, like lying out in the sun without protection. There you go. That's a lifestyle choice. Infectious agents like human papillomavirus can cause DNA mutations. So, in reality, everything's interrelated. So we talk about things as being separate. This happens all the time, but things are interrelated. Everything's happening at once. So some terminology differentiation is each cell type differentiates and carries out particular functions. So our liver cells differentiate into what they have to do, and our heart cells differentiate into what they have to do, etc. The structure reflects the function of the tissue. Totally makes sense, right? During mitosis, it's part of the cell cycle. It requires genetic control, DNA and RNA control. So if that control gets wacky, mitosis can be out of hand. A mutation is if the DNA in the parent cell is altered and passed on, the offspring cells, or the daughter cells, as they usually call them, carry the mutation. And so every time they replicate, they also have the mutation. And as we remember, apoptosis is that programmed cell death. It's controlled by genetic elements. So what if the DNA gets mutated and you're not killing off the cells that are scheduled to be killed off? That could be a problem too. So the etiology of cancer or the development of cancer, it can begin with a single cell mutation, like from UV light damage. The mutation is then passed on to daughter cells through mitosis, and the cells grow and reproduce without regulation. There are three cellular checkpoints that normally prevent this. If the checkpoints fail, then you can develop cancerous cells. So there are key players in cancer development. There are some genes that are called proto-oncogenes, and oncogenes are cancer-causing genes. So proto-oncogenes can become oncogenes. There are tumor suppressor genes, which can become diminished and ineffective. And then apoptosis is normal, but if it gets turned off, then that could cause a problem. Regulatory T cells, so those natural killer cells, remember those guys? They are unable to stop uncontrolled replication. So as we get older, we have fewer NK cells, and that so people who are older have more of a chance of developing cancer for different reasons. So things go wrong. If you develop cancer, something's gone wrong. So carcinogenesis is the process by which normal cells are transformed into cancer cells. So the process varies greatly with respect to time. So sometimes certain types of cancer develop very quickly, some of them develop very slowly. So cancer is thought to be a factorial disease because there are environmental effects, there are changes in gene expression, and sometimes infection like cervical, head and neck, and hepatic cancers can be caused by human papillomavirus or hepatitis virus. So some cancers have well-established risk factors and some do not. So these are the stages in carcinogenesis. And I don't expect you to know this in detail, but just so you know, you get initiating factors and then exposure to promoters. That's basically so there's something that initiates it. It's not really creating an active neoplasm, but then the promoters come in and promote tumor development. Okay, so just initiation and exposure to promoters. That's all you need to know. Normal cells versus cancer cells. So normal cells, they do their job. They show up every day, do their job. They participate in organ function. They follow the rules. They know when to grow and when to die. They're cohesive. They stick together. Teamwork makes the dream work. They die when they're supposed to. They go through apoptosis and they respect tissue boundaries. They don't just invade other tissues because they're in a bad mood. Cancer cells, and they're baddies. they function only to replicate themselves. They don't do their normal organ function. They go, we don't care what you guys are doing. We're just going to replicate ourselves. They ignore growth regulation signals. They are less cohesive, so they break off easily. That's not good. They avoid programmed cell death. So when they're supposed to die, they're like, no, I'm sticking around. And they invade surrounding tissues and starve normal cells of nutrients. So, good coworkers versus bad coworkers. One of them eats your lunch, the other one brings you lunch. So, oh, some days I tell you what's going on in my brain. So, different some specific cancer types. Bone cancer is pretty rare as a primary type of cancer, but often other cancers metastasize into bone cancer, where so the invasion comes from other tissues. Examples of types are osteosarcoma and Ewing sarcoma. Those are bone cancers are more common in young people. The symptoms are persistent and unusual bone pain, swelling, or unexplained pathological fractures. Brain cancer can be primary or metastatic, and the symptoms are going to vary by where the tumor is. So the treatment for brain cancer is typically surgery and radiation and then combination therapies. So yeah, you don't want that. You don't want any of these really. Breast cancer is most common in females, but it can occur in men. It's the second most fatal cancer in women. And the risk factors include family history, age, obesity, hormones, exposure to radiation. 90% cure rate if treated before it metastasizes. Yay, that's a good cure rate. Lung cancer is the most deadly cancer for both men and women, and it metastasizes rapidly. Smoking, there's smoking again. It's a major risk factor for so many things, so just don't do it. Symptoms include cough, sputum, shortness of breath, chest pain. Those sound familiar, huh? Lung cancer can be thought to be something else. It could be thought to be lung disease or thought to be the chest pain can be misconstrued as heart disease. So it's really important when you start having these symptoms to get it checked out ASAP. Colorectal cancer is very deadly, but if it's caught early, there's a good prognosis. Colonoscopy, up until pretty recently, last couple of years, it's been recommended at age 50 and above, but now they're saying 45 and above. There are often no early warning signs. If you get colorectal cancer at age 45, you have a much better survival rate than if you get it later. So, the risk factors include age, polyps, and inflammatory bowel disease, which erodes the inside of your colon. So get their colonoscopy when you're the right age. It's not that bad. People like to complain about it, but I just had one. It was fine. Prostate cancer, second highest death rate in men. Lung cancer's top. Usually affects men older than 50. There are often no symptoms until the late stage, but there's a good prognosis with early detection, and there are early detection tests they can do. So the moral of the story on that one is get regular medical checkups. Clinical precautions for PTAs for all types of cancers. If the patient is immunocompromised, avoid busy gym environments. Don't expose them to other people. Don't treat the patient if you are ill. Maintain strict infection control. So when you look at this picture, the therapist is wearing a mask, the other person over there is wearing a mask, the patient is not, but we're protecting him. And I would say everybody wear a mask, but that's just me. Monitor for signs of infection, certainly. Radiation therapy can be really hard on surrounding tissues. Skin changes can make the tissue fragile. You don't want to use any thermal modalities like heat or cold. Because of the skin changes in the fragile tissue, they're at a higher risk for pressure ulcers, and they have slow healing times. So that is definitely an issue. More precautions if someone has bone metastases, they have a higher fracture risk, and so you have to modify activities accordingly. And it's very important to handle this person gently. If someone is undergoing certain kinds of cancer treatment, they might be more easily fatigued. They might experience nausea and vomiting. They need gentle exercise programs. slow progression, and you continuously have to monitor how they're doing. They could be okay one day and not okay the next. So just be very careful with these people. For breast cancer, you want to definitely instruct in range of motion activities for upper extremity, monitor for signs of lymphedema so we know when to refer them to our lymphedema therapist. So lymphedema risk exists for all cancer patients because if there's any kind of metastasis into the lymph system, which is pretty common, um, lymphedema could be a risk. Aquatic therapy, if someone has unhealed surgical incisions, even if it's not for cancer treatment, any kind of unhealed surgical conditions, don't put them in the pool. If someone has a colostomy, I don't know, that seems like common sense. Don't put them in the pool. Um, there is a higher infection risk in the pool. So if someone is immunocompromised, aquatic therapy might not be the best choice for them. So for our key takeaways, remember that cancer patients are medically complex. There's lots of things going on. Safety first, you always consider precautions, communicating with the supervising PT and all the rest of the healthcare team is essential. Gentle progression, infection control, skin integrity, really important. Patient education, very important. So we're going to implement our PT plan of care safely, and we're going to closely monitor our patients' responses and recognize contraindications. So most of the modalities are contraindicated for cancer. So just be aware of that. Communicate any concerns that you have promptly and provide compassionate care. One time I was working in acute care, and I was working with someone who had advanced ovarian cancer with a very poor prognosis. And really, the only thing she really wanted to be able to get home and see her dog, which I thought was kind of sad. But um, each day that I went in, I would say, how are you doing? Do you feel like doing anything? Maybe some light stretching in the bed. Some days she wanted to walk. You have to be compassionate that these people are going through a lot, and um, so you're not cracking the whip on this. You're compassionately providing what they need that day. So cancer is a complex group of diseases with varying prognoses. Understanding the difference between normal and cancer cells is fundamental to understanding cancer. Staging and grading, which we'll talk about in the next lecture, help determine the treatment prognosis. Lots of different treatment approaches to cancer, and we'll discuss some of them. We play an important role in cancer patient rehabilitation. Safety precautions are extremely important, and communication and careful monitoring are key to successful outcomes. So think about these questions, the key differences between benign and malignant tumors, why early detection is important. We'll talk about the TNM staging system in the next lecture and specific precautions that we need to take when working with cancer patients. And think about why thermal modalities are contraindicated after radiation therapy.